This is one of those questions a lot of EMTs get wrong, but you're not going to because we're going to go over it. A 54-year-old female calls 911 complaining of sudden shortness of breath and chest pain. EMS arrives and finds a patient sitting upright and on her couch, but visibly anxious and struggling to breathe. Her husband states that she was walking from the bathroom to the living room when she suddenly grabbed her chest and said she couldn't catch her breath. Her husband tells EMS she was just discharged from the hospital 6 days ago after surgery to repair a fractured tibia sustained from a fall. Lungs are clear, respiratory rate is 34, heart rate 132, pulse ox is 88%, and we have a blood pressure of 92/58. This is one of those questions I always wondered why new EMTs struggled with it on the test, and then I realized they're seeing clues as distractors. Let's take a look at the clues in this question. There's a lot of things this could be. It could be a tension pneumo, it could be sepsis, it could be a heart attack. All those things can cause hypotension and chest pain. And to avoid the what ifs, we need to look at the clues. Now, the shortness of breath and the chest pain, they help us narrow it down. That kind of tells us what part of the body. We know that we're probably dealing with either the heart or the lungs. But the biggest clue here is that she was discharged from the hospital 6 days ago after surgery to repair a fractured tibia. Now, sometimes EMT students take these little facts that they throw into the question as distractors, but they're not actually distractors, they're clues. Remember back when we were in elementary school and Susie had 3 apples, Johnny had 5 apples, and Frank had 3 apples. How many apples does Susie and Johnny have combined? Well, they threw in Frank to distract you, and a lot of people think National Registry is like that, but it's not. So when you come across this question and you see those aren't distractors, those are clues. And that helps us narrow it down. Well, after surgery, the patient's body's clotting mechanisms are in overdrive. And that's a normal mechanism. A matter of fact, that's what stops the bleeding. But if one of these healthy clots breaks off or the clotting cascade is just getting out of hand, that clot breaks loose and enters into the circulation. Well, the blood vessels are getting larger and larger as it works its way back to the heart. They don't start to become smaller until it works its way into the lung. That's why clots that form in the venous system end up in the lungs. Now, when it gets to the lungs, well, now the right ventricle can't pump blood past it, which lowers the amount of blood that the left ventricle is getting, so that decreases the blood pressure because it decreases preload. And the blood coming from the right ventricle is on its way to the lungs to pick up oxygen. And if that blood flow is blocked, even though the patient's moving good air and they're breathing, they're not onboarding any oxygen, and that's what leads to the hypoxia and the shortness of breath. So the right answer is pulmonary embolism. How do we come to that conclusion? Don't think of what it could be. Think of what it most likely is. The recent surgery in this scenario wasn't a distractor. It was a clue. And now you won't miss this question on the next test unless you forget to subscribe. Until next time, be safe.